cheers of celebration. That was a birthday party breaking out there. Seemingly not much, though, in the way of physical distancing, as Toronto officially entered phase 2 of reopening. Bars and restaurants can now serve customers on their patios. This downtown watering hole wasted no time, opening its doors literally just after the stroke of midnight. They let people in one table at a time, but as you see in these pictures, things filled up very quickly. And our video journalist tells us that staff had to remind people not to gather around other people's tables, not to congregate. Very little in the way of physical distancing going on there, and certainly no masks. Peel region also enters phase 2 today, so people as well neighbouring Toronto can now not just go to the restaurants and bars, but visit the salons and the barber shops, public pools, shopping malls. And we're going to bring you some live coverage just for outside one of those malls a little bit later on this morning. But how to do all of this safely in the most populous region in the country with the virus still making itself felt. Dr. Eileen de Villa is with us this morning, Toronto's Medical Officer of Health. Good morning. We're just so pleased to have you on the program, Dr. de Villa, on this milestone day.
Good morning, and thank you for having me.
You were just listening. I don't know that you can see them from your vantage point. We did share them with your office staff, the images that we were just showing of that one establishment in Toronto. Here they are again. Opened its doors, try to keep things safe, spaced the tables. But, you know, what happened just after people got in there, milling about, close contact, close proximity, just minutes after reopening. What does that signal to you?
Well, it signals to me a few things. One, I think it signals that many of us are eager to get back out and enjoy our city. We have been cooped up, kept indoors and separated from our friends, our families, and our loved ones for several weeks now in response to COVID-19 and seeking to control the impact of that virus on our community and on our health. So I think what we're seeing is a desire, a very human desire, to reconnect with people and frankly, to enjoy our city. I think we're going to be learning for quite some time how best we live safely with COVID-19 in our community. And I suspect we're not going to get it right away. But I do hope that people appreciate and understand that there are some important measures that we need to continue taking for our health and the health of everyone around us.
Well, as you look at those images and we look at the trends, the number of cases, people under 29 in this country, a full third of the cases in the past week, and you see that demographic in that establishment. And we saw the shots from Cherry Beach, a beach in Toronto over the past weekend, all sorts of people there in a dance party breaking out. Obviously, this is a younger demographic. And you're quite right. I mean, it's easy to understand. They don't want to be restrained anymore. It's summertime and they want to see their friends and enjoy the city. But how do you get the message through to them that there still are risks?
Yeah, so that's an interesting challenge, I think, that falls to all of us in public health, certainly, and I would argue the entire community as a whole. We're trying to put messages out there in a way that allows people to enjoy the city, to enjoy our all too brief summer, but at the same time balances out, you know, how best do we maintain that physical distancing? Because we know that things like staying home when you're sick, maintaining physical distancing, at least 6 feet where possible, being in outdoor space is certainly a help, but washing your hands and doing all the public health measures that we've talked about for several weeks now, these continue to be the mainstays of prevention in terms of reducing the impact of COVID-19, the negative impact of COVID-19 on all of us. And yes, that includes younger people in our community. So we're trying several different methods to see what we can do, whether it's painting circles, creating circumstances that actually allow for people and that make it easier for people to do the right thing. I think this is the challenge before us all as we seek to live with and learn how to live with COVID-19 in our community.
If people do not follow the rules, though, are you prepared to force the city back into stage 1?
Well, I think the reality is this. As much as we want people and hope for people to follow the rules because they're interested in keeping all of us safe, the reality is that this virus, you know, does what it will, right? And we are seeing that. We're seeing the experiences in other jurisdictions. And certainly as we open up, as we need to restore some of the regular activities and services in our community. With more people moving around, there by definition is more risk, and more risk for people interacting with each other, and more risk of virus transmission. And I think we'll have to judge and make the best decisions that we can with the information that we have in front of us in terms of what makes sense to best protect our community. But in the meantime, we ask that people do try to stick with the public health measures and advice, maintain that physical distance as much as possible, even when you're outdoors.
I realize that we're just on day one of reopening or moving into phase two, and it seems premature to talk about returning to shut back down again. But based on those few pictures, those initial scenes, it doesn't bode very well. So I'm wondering, what would it take for you, in fact, to say, too many cases, too much spread too quickly, we have to go back and return to a phase one scenario?
Well, I think what we've put out there in order to communicate to the public and to help people understand where we are, at Toronto Public Health, we've put out a monitoring dashboard so that people can actually track our progress and see how we're doing in our response and in our progress against COVID-19. So we will be monitoring case rates. We will be looking at the capacity of our healthcare system to accommodate patients, whether it's with COVID-19 or COVID-19 related illness or other medical conditions, because of course there are other conditions that are out there. We will be looking at how our, what our tests look like as our province tries to ramp up and seeks to ramp up ongoing testing, and how many of the tests that are being done actually come back as positive. These are the variety of markers that we're going to be looking at, but it does come back down to the behavior of our residents and our city. Stick with the public health measures. That's the best way forward. We've made lots of progress. Let's not lose it now. We're still learning, but let's not lose our good progress and lose the benefit of our hard work on a few days.
You mentioned the testing. Certainly one of the most important things going forward in reopening is the testing and then the contact tracing, and we've been talking about the app to facilitate that. Do you have confidence in Toronto's ability and capacity to do that sufficiently?
Yeah, we have invested a great deal of time and effort. We have expanded our team. So at the very beginning of COVID-19, we started out with a case and contact management team of 50. We are now several hundred strong and still growing in order that we have surge capacity to manage that. We've changed to a new database and an information management system. We've done an internal process review. We brought in external partners to do a process review, all with the goal of ensuring that we have the best case and contact management system possible. Are there opportunities for improvement? There are always opportunities for improvement, and we're going to continue to capitalize on that and continue to try to make our response as robust and as fulsome as it can be.
And let me ask you finally, Dr. de Villa, we're talking this morning in our news about British Columbia, which is a province that's been praised for how it's handled COVID-19 and restricting, flattening the curve quickly and its mitigation strategies. But BC is already warning of what's happening since reopening, warning that it's in a delicate balance, delicate period, and may have to take some measures because the cases are worrisome. We certainly see what is happening in the United States, a number of cities which have reopened very quickly. What are the lessons for you and for Toronto as you look to those cases and plot the way forward for Toronto?
So I think it's very important, and it's something that we've done all the way through. We are constantly looking at the experiences of other jurisdictions and seeking to incorporate lessons learned from those other experiences into our response. And I think what it tells us is that we do need to be constantly vigilant. This virus continues to teach us on a daily basis. And I think we need to continue that very important communications and dialogue with our public around what they can do and how important their role is in terms of controlling the spread of COVID-19. So staying home when you're sick, making sure you're maintaining physical distancing as much as possible. And if you can't maintain that physical distance, especially in an indoor public space, wear a cloth mask, wash your hands, don't touch your face, to the extent that you can avoid that. These are the really important elements that everybody, each and every one of us, can do to protect ourselves and to protect each other.
Important messages today, and certainly messages you have reiterated during your daily briefings. Let me just ask you, as I say thanks and goodbye, now that you can, I'm just trying to get a gauge from you. Will you today be on a patio if you have time? I know you're super busy with everything going on, but will you be on a patio? Do you feel comfortable to go into a mall? Would you get your hair cut if you need today? Would you be willing to do whatever you can today in Toronto?
Well, Heather, sadly, you're quite right. My schedule does make, those kinds of, personal luxuries a little more challenging. But suffice it to say that I know that if you take the appropriate precautions, as I've just described, maintaining that physical distancing as much as possible, using a cloth mask where that physical distancing can't be maintained, washing hands frequently or using hand sanitizer, all of these things taken together will allow us to re-engage in those activities, whether it is getting that much needed haircut or going to the store to pick up whichever items you haven't been able to pick up, or even to enjoy that patio. We know that the risks outdoors are certainly lowered. Okay. But I think taking all those public health measures will put us in good stead and will allow us to continue with those activities as safely as possible.
I'll put you in the if time world to allow, you would do them if you could. Much on your plate still, but listen, thank you for the time this morning, and we will certainly be listening in to further briefings from you as you continue to guide the city forward. Dr. Eileen de Villa, Toronto's Medical Officer of Health, we thank you very much.
Thank you.